Your substance abuse treatment plan is the driver behind every evidence-based intervention, and most plans miss the one thing that makes them work. Without a treatment plan, there is no roadmap, no insurance documentation, no benchmarking, and no way to coordinate care across your clinical teams. Treatment without a treatment plan simply does not work. The question is whether yours is truly patient-centered. We will cover the 4 steps in every plan, what patient-centered really means, and how the right EHR helps your team build it. So, what is a substance abuse treatment plan? It is the documentation your facility needs for insurance claims, clinical planning, and care coordination. Every substance abuse treatment plan has the same 4 parts, regardless of which EHR or program you use to create it. But a plan is more than paperwork. Done right, it becomes a powerful healing tool that puts the patient in the driver's seat. Too many clinicians race through treatment planning, using cut-and-paste boilerplate and entombing it in a chart, never to be seen again. That is a missed opportunity. A generic plan documents care, but it does nothing to motivate the patient or drive recovery. An individualized treatment plan the patient owns builds the motivation and engagement that generic boilerplate never will. Here is the difference. A generic EHR gives you a blank box. Behave Health is designed to support individualized SUD treatment planning directly. Intuitive, easy-to-use templates and forms streamline every part of treatment plan creation. The platform is designed to make plan creation collaborative and intuitive, not a cut-and-paste chore. Complete a plan on a computer, phone, or tablet for maximum flexibility right in the clinical environment. Every substance abuse treatment plan is built from 4 steps. Skip the structure, and the plan falls apart. Let us walk through all 4. Step 1. Identify the problems. Write a problem statement about the patient's presenting issues, backed by evidence from assessments like a biopsychosocial. For example, the patient presents with alcohol use disorder from the biopsychosocial and moderate depression from their PHQ-9 score. Step 2. Create goals. Goals describe the desired outcome of treatment. For example, the patient may want to achieve sobriety from alcohol and improve the self-esteem issues driving their depression. Have the patient name their goals in their own words and write those down exactly. Step 3. Name objectives. Objectives are what the patient will do to reach their goals. Objectives are the nuts and bolts, the who, what, where, and how of the patient's journey through treatment. For instance, one objective might be for the patient to attend daily group counseling sessions. Step 4. Define interventions. Interventions describe what you, the clinician, will do. Interventions are the clinician's part of the plan, the actions you take to move the patient toward their goals. For example, you might challenge the patient to discuss self-esteem concerns in group, then provide accountability afterward. 4 steps give you a plan. To make it patient-centered, change who is holding the pen. Here are 3 ways to do it. First, co-create the plan. Do not just involve the patient. Put them in the driver's seat. Brainstorm objectives with your patient and incorporate their ideas so the plan reflects their voice. Teach patients how to write SMART goals and practice creating them together as you complete the plan. Second, give them ownership. A patient-centered plan should be a document the patient owns. It should be their document, their plan. This is their treatment journey, after all. Give them a physical copy or show them how to access their plan anytime in the patient portal. Third, keep involving them. When you update the plan, bring the patient in at the ground level again. Every time the plan changes, involve the patient in the update. Ownership is not a one-time event. Patients who own their plan stay more motivated and build one of the best recovery skills you can foster. This is where the platform matters. Behave Health is designed to put your whole workflow in one place. Clinical, admissions, treatment plans, billing, and insurance authorizations all live in one all-in-one app. ACRM, built for behavioral health, helps your team track patient engagement from the first contact through treatment completion. The result is individualized, patient-centered treatment planning your team can actually keep up with. Stop burying boilerplate treatment plans in the chart. Build individualized, patient-centered plans your patients actually own. See patient-centered SUD treatment planning built into the EHR. Book a demo at behavehealth.com.